Did it go? Okay. Hi, my name is Danielle, and I'm a nursing student whose clinical was at the VA on 5A. I'm going to present a patient to you right now. Patient is a 65-year-old single Caucasian male. He is a retired CEO that was involved in banking. Patient was admitted on March 22, 2013 for a thyroidectomy. Post-op day 11 due to complications from the surgery, specifically drainage. Sputum is clear except it turns milky from intake of fatty foods. Irritation from current problems started in November with a scratchy throat. Patient describes his symptoms as having swollen lymph nodes, cramps in neck, trouble breathing, yet no pain. Patient says there has been a lot of anxiety because the doctors did not know what his problem was. He was under the impression he would have to go through chemo. Patient tried alleviating irritation by using several different kinds of inhalers quite frequently. Patient is currently experiencing no pain from the surgery. He is frustrated from being on a feeding tube for 5 days now. Feeding tube causes coughing and choking. Vital signs are stable. Blood pressure 136/60. Heart rate 86. Respirations 22. Past medical history. Developed asthma as a child around the age of 10. During his layoff, which patient said was a couple years ago, he saw a psychiatrist for about a month. Immunizations are up to date. Drug allergies. Allergies are unknown but are being looked into because when more drugs are administered, vomiting spells occur. 4 have been noted thus far. Past surgical history. Patient had a lymph node biopsy in early March, papilloma removed from throat. Additionally, pulmonary blood tests were performed due to the spots on his lungs. No other surgeries worth noting. Current medications. Patient is on Triotide, Oxycontin, morphine, Epirin shots, antibiotics, and muscle relaxers. Functional assessment. Patient does not and has never smoked. Alcohol use consists of 1 beer, but patient states that alcohol gives him heartburn. Patient drinks 1 to 2 cups of coffee a day. Physical activity consists of walking or running 3 to 4 miles per day. However, this stopped in November due to the onset of the problem. Normal sleeping patterns noted aside from some sleep disturbances from anxiety. Psychosocial. Patient takes care of his 94-year-old father with his sister. Patient states that he has a good relationship with both of them, however, does not have a lot of support outside of the family. Family history. Mother had spinal meningitis, asthma, and Alzheimer's. Father had bladder cancer. Respiratory. Because patient is producing sputum and has a history of asthma, it is important to perform a respiratory exam. Patient denies shortness of breath, cigarette smoking, and respiratory diseases like emphysema and COPD. Patient does have a history of asthma. Cough is present, which is often followed by sputum. Upon inspection, patient has more labored breathing, but facial expressions and limb movements are relaxed. Transverse diameter 1 to 2. Patient has a stable chest wall, no crepitus or bulging, tenderness or cyanosis, normal tactile fremitus, and thoracic expansion. Labored breathing and light wheeze were present, no crackles, normal bronchophony, egophony, and whispered pectorality. Abdominal and nutritional. It is important to do an assessment of the patient's abdomen and nutritional behavior due to the fact that he has been on a feeding tube for 5 days. Patient denies previous abdominal surgeries, as well as peptic ulcer disease, gallbladder disease, hepatitis, renal disease, Crohn's disease, and irritable bowel disease. No nausea, change in appetite, change in bowel habits, heartburn, GI upsets, rectal bleeding, constipation, or diarrhea. Vomiting is only present from increased intake of medicine. Patient also denies chewing and swallowing difficulties, eating disorders, social isolation, and decreased eyesight. Patient scored a 12 on the mini nutritional assessment. Upon inspection, there were no lesions on the abdomen. Surface motion and contour was normal. Color was normal as well. However, bruising was found on the right lower quadrant due to injections. Normal but loud bowel sounds were noted. No bruise. From light and deep palpation, no masses, tenderness, or pulsations were found. Peritoneal irritation was checked by performing cutaneous hypersensitivity, rebound tenderness, obturator test, and allopostase test. No pain experienced in right lower quadrant, specifically the appendix. Peryton system number 1, cardiac. A study performed by Dr. Robert Eckel indicates that most of the comorbidities relating obesity to coronary artery disease or cardiovascular diseases in general increase as BMI increases. Because the patient has a BMI of 35 indicating obesity, it is imperative that a cardiac assessment is performed. Peryton system number 2, neurological. Based off of the mini mental exam score of 22 and the patient's age, it is important to do a neurological assessment. Forgetfulness is a part of growing older. However, with his mother's history of Alzheimer's, it is definitely something to look into.